Welcome back to OET Prep Talks with me, Milen Jacob. Today I'm going to talk about a topic which a lot of candidates have asked me to explain, and that's a pretty contentious issue where you hear a lot of advice, probably wrong advice, that you should not be using modal verbs like should or must in OET. So should you use should and must? Well, it's debatable for a lot of people, but I'd say you can absolutely use should and must in OET, whether it's in speaking or writing, that's fine. But it depends on how you use it. Perhaps, using it with the wrong tone might not be really helpful. So let's explore. I'm going to discuss a few contexts in which you can use these modal verbs. And this is not an exhaustive list, but rather a few instances which will be helpful in OET, whether it's speaking or writing. Firstly, we can use should or must to express your reaction to what a patient might say, particularly in speaking. So let's imagine the patient says they have been in awful pain, and then you can show your reaction by saying, I can imagine it must have been terrible, or it should have been really a nightmare for you to go through the pain. All right, so that's one example. Okay, so now let's look at another instance or context in which you can use these models, and that is to deduce or to infer or to come to a conclusion. Let's say the patient says, it's been really, really hard with this tingling sensation, and then you can say it must be this, or it seems like it has to be whatever condition, right? So that's how you express your inference or conclusion. Or it must be a common cold or glandular fever based on the what you feel. And even in writing, you could express your inference or conclusion. Let's say when you are talking about the provisional diagnosis, it must be whatever that you think the problem is. Another context is when you're giving advice. So you must go for a healthier diet with a lot of fruit and vegetables. You should take a lot of rest, probably until you recover completely. So to give advice, you can use models, or you have to as well. I think you have to take a month off from work. So that's another context in which you can use modal verbs like should, must, and have to give advice. You can also encourage your patient with should or must, like I think you should join an exercise program or hit the gym. So you're encouraging them, all right, or inviting them even to come back to the clinic or the GP surgery. You can use like you should come back in a week's time, or I think you must come back again, all right. And to prescribe or suggest tests or medication, you can use should and must, such as you should have a blood test done, or I think an MRI scan must be taken. Perfect, right? So now again, this can also be used for obligations, such as you're writing to a nurse to visit a patient, and so she or he would be obliged. So daily visits must be done. So it's kind of like ought to. You ought to visit the patient every day. So these are some of the different contexts or uses of modal verbs like should, must, and have to. All right. Now, remember, it might be a problem if you use it with a wrong tone, especially the wrong kind of intonation, where you could be harsh and it's less polite, such as you should, immediately do something, or, you should not do this, or, you should eat healthy food. So it's not about the modal verbs in itself, it's about how you speak, and that gives a different meaning. It's not polite, and that is not acceptable. And remember, in the negative form, it may have different meanings as well, particularly must and have to. For instance, you mustn't walk too much. That means it's not advisable to walk too much. But if you say you don't have to walk too much, that is like it's not necessary, but you may, and it gives a different meaning. So although in the affirmative, must and have to have similar meanings, in the negative form, they mean different things. So that's something which you should be really careful about. So I hope it's clear that you can use must and should and have to in OET. It will help you to perform better. In fact, even OET has officially come out with an explanation with this some time ago, when a lot of candidates were asking these questions. So I thought, again, I would do this session to clear the clutter and help you with your OET preparation. So good luck with your studies.